Hello everyone, my name is Mason, this is Kai. Welcome to our first video. Today we're breaking down everything you need to know about lower back health, injuries, and how to train smarter.
This is our introduction to our series we're going to call Smart AF Training. Every month we're going to be releasing an awesome educational video and some of the most common things you're going to encounter with all of your clients.
Alright, let's get started.
So to get started, I really wanted to share some really important statistics regarding the lower back pain to show its relevance within the client base that we're going to be working with. 80% of people will experience some sort of lower back pain over the course of their lifetime. Meaning out of every 10 clients you work with, 8 of them are likely to experience back pain. Now, for the most part, within our clientele and future clients, most of them have jobs. And so I wanted to bring this up because if you look at all working adults, 50% of them each year report some sort of lower back pain. Another important statistic I wanted to bring up is that 85 to 95% of reported lower back cases are what are considered as non-specific. What this means is that the lower back pain doesn't necessarily mean it started with the lower back. We're going to cover that in more detail later on. Lastly, lower back pain is considered the leading disability worldwide. If we have mastery over how to help people overcome lower back pain and not just avoiding the lower back, but learning how to rehab and overcome and then build a really strong lower back with everyone we work with, they're going to really love the process. They're going to respect you a lot more as a coach. They're going to tell everyone about it.
The next thing we need to understand is why these injuries happen. If they're so common, what is the most common culprit? Well, for most people, it's going to start with poor lifting mechanics. The super rounded thoracic and lumbar spine on a max effort deadlift attempt, for example. Everyone's seen it. We know it's a recipe for disaster. Same thing can apply for any movement that has axial loading. It could be a barbell row, a dumbbell row, anything where the weight is being pulled across the spine and down. The next common culprit is going to be muscle imbalances. This could be weak glutes or hamstrings, overdeveloped quads, perhaps an underdeveloped core. Most people don't pay too much attention to the muscularity of their posterior chain. That's going to be detrimental to any movements where you're hip hinging or putting load on the spine. The next common culprit is going to be excessive sitting. Tight hip flexors, tight hamstrings, that's going to pull your pelvis forwards and put a lot of pressure on your lower back. And the fourth and final most common culprit is going to be overtraining and recovery issues. The lower back has a very poor blood supply when compared to other muscle groups, so it's going to take longer to heal. This is especially important for exercises that have a very high ratio of fatigue to stimulus, like a deadlift or a squat. Now that we've covered all of that stuff, let's talk about training for the lower back. What specifically should we be doing and avoiding? When training clients or yourself, you can keep these considerations in mind. First, you want to avoid early spinal flexion, so early in the workout. No heavy sit-ups or Jefferson curls right in the beginning. Second, you're going to want to focus on neutral spine mechanics, so thinking of a hip hinge versus a back bend. And finally, you're going to want to really strengthen the posterior chain. The reverse hypers, deadlifts, bird dogs, anything with the glutes, lower back, hamstrings. For example, for disc bulges, the McGill Big 3 is going to be your best friend. That's going to be a bird dog, a side plank, and a curl up done in succession. For SI joint dysfunction, single leg work is going to be your best bet. Step ups, single leg RDLs, very slow tempo lunges, things like that. And for chronic tightness of the lower back, you need to focus on glute activation. Things like clamshells, monster walks, hip thrusts. As far as sets and reps goes for the following movements, it really depends on the demographic. If it's someone a little bit weaker and kind of detrained, I would stick around 1 to 2 sets, somewhere between 15 and 20 reps. But the stronger and more conditioned athletes can do a little bit more volume, a little bit more intensity.
So let's say you have a client and their lower back hurts. What does that mean? Now, lower back pain can be a little bit confusing because it can come from the back or it can be referred and it starts somewhere else in the body. So over this section, we're going to talk to you about how to identify what leading factors contribute to the lower back pain and what to do after you identify what that is. We're going to be covering some of the most common types of lower back pain. Now, when you start with a client, you always perform a consultation and you really want to get a medical background of them. It's also important to note that we're not physicians, so if someone has a lot of severe back pain, it's important that they consult with a physician first so you can get a better insight as to what the back pain is.
This becomes especially important when we have someone we're not sure if it's a serious back injury or if it's just some minor pain. Sometimes it's hard to tell.
Now we're going to start covering the different types of lower back pain, starting with herniated discs and bulging discs. A lot of times you'll talk to someone and they'll just say like, I broke my back. Or they won't even tell you that they did. What is a herniated disc and what's a bulging disc? I want you to think of this as a jelly donut. The jelly is going to be the liquid stuff inside of your spine in the discs. The donut itself is going to represent the bone within your spine. What happens with the herniated disc is that jelly is going to push outside of the donut. Think the crust. It's pretty good stuff. The bulging disc just means the jelly is going to be pushing and protruding into the crust of the donut, but it's not coming out of it. What does that mean? Well, basically, you're having a full break or fracture with a herniated disc. Bulging disc, there's just protrusion. Now we're going to talk about, after figuring out and identifying if someone has a herniated disc or bulging disc, oftentimes it's going to be different symptoms they're going to describe, or you're going to have an MRI and there's going to be some notes from the physician. Let's talk about an action plan of what to do and what to avoid. So oftentimes with a herniated or bulging disc, people will experience pain or discomfort if they're sitting for a long period of time. So think a lot of people working at desks, your typical accountant, people who have to commute and drive a long time. People basically, if you're sitting, if you like some Netflix, if you're sitting for a long period of time, you might feel some discomfort. Any movements that have flexion in them, meaning doing something like this, you often also might have some pain with a cough or like a quick movement with the body where there's excessive squeezing. You also might have a little bit of radiating pain down the leg if a nerve starts to get involved.
If you're training core, you probably want to avoid sit-ups, which is an example of flexion. As an alternative, you can focus on something that includes core stability, like this Bosu ball plank. Or even better, something that includes spinal distraction, like a hanging leg raise.
Lastly, one of the most amazing things you can do when your lower back hurts or you have a herniated bulging disc, something called belt marches. It's going to be awesome because it's just pulling at your lower back. It's a really wonderful stretch. It gives you some good cardio and your glutes get involved. The next type of injury is your typical muscle strain or connective tissue strain. This is often caused by sudden overload, or think you're just picking something up heavy for the first time in a while. Or it could be caused by overuse or repetitive motions. Think someone working in a factory doing the same movement every single day for hours and hours. Another common cause of this is just lack of core control and stability. A really good example of this, a lot of people hurt their lower back when they're twisting and reaching back into their car in the back seat. A lot of times if they don't have the strong core, transverse abdominis, and obliques, that's going to lead to compensation at the lower back. Oftentimes a muscle strain or a connective tissue issue is going to be localized pain, meaning there's going to be pain at one specific spot. So a lot of people will say like, oh, my back hurts right here. And there's going to be a lot of tightness and stiffness too. It's just going to take a little bit of time to heal, so back off of anything that's causing pain and make sure you're doing the proper motor patterns. And think of this type of injury as an overstretched guitar string.
The next condition we can discuss is a degenerative disc disease. You can think of this like an old car with rusty shocks. There's going to be less conditioning and more pain overall. A common symptom of this is just a dull ache throughout the day. A lot of people will come in and just say, oh, like my back is just kind of aching. Not necessarily in excruciating pain, but not feeling very good either.
You're just losing bone density over time in your spine. Depends on the area of your spine, but for the most part in the lower back, something like this, the reverse hyper, it's going to build muscle and strength and bone density specific to that area that's degenerating. What that means is that your bones are going to get denser and stronger over time with progressive overload.
Along with the reverse hyper, the 45-degree back extension is a fantastic way to strengthen the posterior chain. The next condition to cover is facet joint syndrome. If you think of your spine's joints like rusty door hinges, too much extension is going to lead to grinding and a painful effect. Some common symptoms of this are pain when arching or twisting.
A lot of times you'll see people with back pain and they start doing like a cobra stretch, something like that. Definitely don't do that one. And then a lot of people love Russian twist, but this is a great example of some sort of spinal rotation that you want to avoid.
A better example of a spinal rotation, or actually spinal anti-rotation exercise, in this case is a Pallof press. I'm going to step out with this cable, and all I'm doing is resisting the weight from the cable to bring it in and out, just like that. My spine's not twisting, but I'm trying to resist the motion of being pulled to the side. So my obliques have to work super hard in order to keep my spine braced.
A fun quick test you can do, it's a PT screening test to see if someone does have a lot of lower back compression or if it just has to do with core stability. Have someone sit down on a stool or a chair, even a bench, and then all you're gonna have them do is have them start in a rounded position. Make sure that they are not in excruciating pain. If there's any pain, you wanna stop. But start with a nice rounded back and have them pull themselves into the chair. If they experience pain with a rounded back, that simply means for the most part that they lack core stability or the ability to squeeze their core muscles to support the spine. If you have them sit nice and tall and then pull in a neutral position, if they're pain-free, they're good to go. If they have pain, it's a compression issue.
The last condition to cover is sciatica, which is sometimes a weird one. More often than not, people will come in and not be able to distinguish this pain from just regular back pain. The way to tell is if it's a shooting pain down one leg, it's often made worse with sitting. If you think of your sciatic nerve like a garden hose, if something pinches it, that's what's going to cause that pain that shoots down your leg. One way that I've had clients diagnose if this is the case, we're sitting, similar to the drill we did earlier, grabbing the bottom of the chair here and extending one leg. If this causes excruciating pain on one side only, then sciatica is your problem.
After watching this video or at any point during this video, if you have any questions or comments, please let us know.
Thank you so much for watching. We'll see you guys in the next one.